What we have continued to emphasize to the legislature is that behavioral health services need to be addressed starting from an outpatient setting and through the inpatient setting and across that continuum. And so from our hospital's perspective, what that means is making sure that benefits exist for patients in the middle. One of the things we are emphasizing and have been for a couple of years now is adding partial hospitalization services and intensive outpatient therapy programs to the Medicaid benefit. It is not a consistently covered service to have those in-between services covered by the state. And when they aren't consistently covered, it makes it difficult for hospitals to financially expand, to be able to rely on a revenue stream. Having a consistent revenue stream for those services means you may be able to expand some of those services and meet more of the demand that we know we're seeing across Texas counties. We will continue to emphasize closing gaps in coverage, so ensuring that we have access to an IMD exclusion waiver, that the state will pursue that waiver application on the federal level. We know from looking at recent data that even getting coverage for the initial 15 days of an IMD stay is difficult to get in Texas. So trying to make sure that we can at least start with a full benefit for inpatient hospital stays for patients who need psychiatric care is critical. Everyone has a family member or a friend who has struggled with behavioral health, and I think knowing that that population continues to increase and that we continue to see more and more children who are struggling with behavioral health care needs, we know at THA that this is going to continue to be a priority, not just for us, but for our individual hospitals, as we all try to work towards addressing the needs of that community.